My name is Doug Blanchard.
And I'm Kathy Sawada, and we are nationally board certified licensed acupuncturists working for CentraCare.
And we're here today to talk to you about what acupuncture can do for addiction. So we've got some basic questions that we're going to go over, and we'll try and give you as much information as you can so you have as much information as you need.
Because acupuncture works to regulate the body's internal systems, it's used to treat most mental and physical disorders.
And it can help with things like smoking, alcoholism, weight management, emotional problems, and just drug addiction as well. Acupuncture helps those from recovering from addiction by recreating the stimulus in the brain that is normally caused by the addiction itself, such as what we get from alcohol or drugs or smoking, etc. The difference is that we recreate the stimulus in the brain in a good way, using the brain's own chemicals to help with that stimulus so you think that's what you're getting.
Acupuncture also helps by strengthening the body's systems that help to naturally detoxify various chemicals in the body. For instance, the lungs, the liver, the kidneys. It also can help regulate the emotional aspects of addiction, such as feelings of anxiety, depression, or even anger.
There are hundreds and hundreds of journal articles, medical articles, showing how acupuncture treats addictions, their effectiveness, what it takes, and what it needs to help.
The best information will be found in scientific websites such as PubMed.gov. It's not good to go to sites such as Facebook or Wikipedia. Their information is not credible and is not often based on the most current scientific knowledge.
True.
Your acupuncture practitioner can help point you in the right direction to look for good quality research.
The most effective treatment for addictions that we use is auricular or ear acupuncture. And we also add a few points to the body, just to help with harmonizing and balancing the body as a whole. It's been shown that auricular acupuncture is one of the most effective ways of treating addictions.
So auricular acupuncture or ear acupuncture is done while you just relax comfortably in a chair. You don't need to take your clothes off or even your shoes and socks. The practitioner will place some needles on the outside of your ear, and then you just relax for about 20 minutes, up to an hour.
As with any treatment, it depends on how severe the addiction is, of course. Whether it's chronic or acute, what type of addiction we're treating, and if the patient is willing and ready to stop this addiction and want the help they need. So regardless of the addiction, acupuncture can really help.
If you're ready to try acupuncture, it's important to find someone who is nationally board certified and licensed to practice acupuncture through the Minnesota Board of Medical Practice. This means that they have a master's degree at the very least or a doctorate degree specifically in acupuncture. It's important to note that most chiropractors don't have this level of education. Your staff at CentraCare can help you find someone in your community that's qualified to give you this acupuncture treatment.
So right now, let us do a quick demonstration of what you would expect to find when you do come in for a treatment. So the first thing you'll notice is we always use an alcohol swab, no matter how many points we use, no matter 1 or 2 points. After doing that, we'll let it dry for a little bit. It takes away the sting, if any. So now what you're seeing is we use little tiny acupuncture needles. They're about maybe ½ an inch long. And in the ear, there are some 200 points that we can work with. Now, the protocol that you're looking at is a standard protocol for drug addiction, whether it be alcohol or drugs. We use 4 to 5 different points in the ear whether they be for liver or kidney or the sympathetic or the parasympathetic system. The ear is extremely powerful and potent when it comes to acupuncture to help with this. Now, as you can see, very simple, very easy. The patient is seated, taking our time, placing them in one at a time, and there you go. Very easy, very simple, and as Kathy stated, they'll sit for 25 to 30 minutes.